of today, I guess, is to give you all an update on the work that you've been supporting with ActionAid Ireland for the past years. Some of you have been supporters, I guess, for in the long term, and some of you are very new to ActionAid. So this is to give you an update around what's been happening over the course of the past year or so in the programme, specifically in Kenya. And you're going to hear from my colleague Yusef Abdi from Kamuthe in Kenya just after me, and he'll be giving you some highlights of what's happening in the programme there, focusing on our behaviour change approach. So the theme of the call today, I guess, is talking about this new innovative programme that we've been piloting since 2017. And we've been doing that with the support of ActionAid, the Government of Ireland. So again, that's your taxpayers' funding. And we're going to give you an update on how that's being spent. And of course, we would not be able to apply for, we wouldn't be eligible to apply for a grant with ActionAid without the direct support from all of your good selves. So it's really to kind of talk a little bit around, you know, all the work that we're doing in ActionAid with the great support of all of you, and also to give you a little bit of an introduction to this new program. So I guess at the end of 2016, we finished up a women's rights program in Africa and in Asia, that was also funded through the Government of Ireland and your good selves. And we had an evaluation, and we're always trying to learn, you know, are we doing things right? Do we need to change anything? And at that program evaluation, it told us we had done lots of great things. We had done a lot of awareness raising with women in terms of, you know, them knowing what their rights were, and they were going to, you know, look for services, legal services and medical services, especially in terms of gender-based violence. But they weren't really getting a great response. So I guess what we learned from the evaluation was that we hadn't really given enough attention to some of the root causes of violence against women and gender-based violence. And we hadn't been working with those government service providers in the countries, you know, the hospitals and the police and others who should be there for women when they have a case of GBV. And we hadn't really been working enough with men and boys. So we teamed up with University College London, who have a Centre for Behaviour Change, and they had been looking at people's behaviours in terms of mainly working with the health sector, actually trying to get people to change their behaviour to possibly do more exercise or to take their medication. And we decided we would try to pilot looking at using this behaviour change approach for a gender-based violence program in Africa and in Asia. So the program is based in Ethiopia, Kenya and Nepal. And we decided to try and look at this methodology to help us better understand people's behaviours. So what was driving gender-based violence, for example? And we know women are more disproportionately affected by poverty and by violence than men in these countries. So we had a huge focus on trying to make communities safer for women and girls. So this methodology that we've been working with University College London now for the past 3 years, and we have a really good partnership with them. And they helped us to look at these 3 components that they believe every behaviour needs to have in order to function. So one of those is capability. So people need to have both psychological and physical capability to be able to perform a behaviour. So if you look at something like child marriage, if people don't understand that, you know, the effects child marriage will have on a girl, you know, in terms of her ending her education at a very young age, you know, having early pregnancies, all of the health difficulties involved in that, then they don't have a high level of psychological capability to be able to change that behaviour. Similarly, in terms of opportunity, which is the other part of behaviour, you know, if there's a lot of pressure from their community to marry their daughters off early, there's very little social opportunity for them to say, actually, no, I want my daughter to stay in school and to finish her education. And then the other part of behavior, motivation, you know, if they feel that they're being a good parent by making sure their daughter is married off, and she's, you know, she's got that secure husband and secure, you know, family to go to, which is an important part of culture in a lot of cases, then they're not motivated to stop that behavior. So there are the three components of behavior that we look at every single time. Is there capability, is there opportunity, and is there motivation for all of the different several behaviors that we work on to try to stop gender-based violence. So it's quite a complex approach in many ways, but I think we've been going along and speaking to University College London and having lots of trainings with them, and we're understanding it better every day. And we've just last week, in fact, launched a field guide on how to use this behaviour change approach in a developing context on a gender-based violence programme, where we use case studies from our own programmes in Nepal and Ethiopia and Kenya, talking about how we use that methodology to be able to change various different behaviours to achieve our overall programme outcomes. So you'll hear more about that from Yusef now in a few minutes. But it was just to kind of give you that little bit of an overview about our programme, and to kind of tell you again, just to really kind of thank you for making that possible, because, you know, without the support of ActionAid, which is your taxpayers funding, and without your own support as well, you know, which is also making a huge contribution to that programme, we wouldn't be able to realise any of this work. And I guess from my perspective here in Ireland, in ActionAid Ireland, I'm very, very proud of the work that we've done. I'm very, very proud that we've been able to produce this field manual as well. And we will hope to share that with lots of other countries within the ActionAid Federation. We're part of a much bigger federation with 45 countries worldwide. And we want to share that with others as well, externally outside of ActionAid, because we really feel that this approach is something that's different, and we need to be possibly looking at new ways to try and achieve our outcomes, and not just kind of continuing with the same activities that we've always kind of done. We want to look at, you know, kind of new and innovative ways to try and I guess make a real difference, and to try and really look at what's driving these kind of underlying causes of behavior, and what's really kind of driving gender-based violence at a community level. So I'm going to hand you over to Yusef Abdi now, and Yusef is our local rights program coordinator in a place called Kamuthe in Kenya. And Yusef is going to tell you about our behaviour change program there and give you some highlights of the work that we're doing. So I'm going to hand over to Yusef now, and then there'll be time for questions and answers then after that. So you can write your question in the chat, or you can raise your hand to ask a question, I think, as well. Okay, over to you, Yusef.
Thank you, Trina. Thanks a lot. Good afternoon, everyone. My name is Yusef Abdi. I work for ActionAid Kenya. I am based in that is in Garissa in Kenya. My apologies. I don't know if my network is clear and you're able to hear me. Trina, am I audible?
You're fine at the moment, yes.
Okay, thank you. So I was saying I'm based in Kenya, and I'm based in where the project is being implemented. The Women's Rights 2 project is implemented. In Kenya, we are implementing this project in 2 sites, in 2 areas. That is in a place called in the coastal side of Kenya, and in the northern part of the country, that is in Kenya. Kenya is in East Africa. Kenya is in East Africa. And so in Kenya, we are implementing, I said, in 2 areas, that is in northern part of the country and in the coastal region, a place called Kishushe. The program or the Women's Rights 2 project has 2 outcomes. It is focusing on 2 outcomes. That is to make sure that women are free and safe from gender-based violence. That is one outcome. And the second outcome is addressing on issues of economic empowerment of women. are secure in terms of their economy. So that is the two outcomes the project is focusing, and that is our focus. What we do actually in the area, how our approach is we use the behavior change approach, and we are working with 500 women. These 500 women are, we call them hard to reach women or vulnerable women. These vulnerable women are women who are who have been abused, who have been violated, women who are elderly women, women who are poor and they don't have many sources of income, women who are single mothers, women who are having children and they're the ones who are looking for food. So these 500 women are poor and vulnerable women within the society. So in Kenya, we are working with 500 women, and those are the categories of the women that we are working with, poor and vulnerable women. How do you identify these people, or how do you identify the people that we are targeting, or the people that we are targeting, the 500 women? We identify them through a process called community-led participatory process, whereby we are working the project. We invite all the community members, come together, have a conversation. They normally have a conversation, discuss and identify these people who are poor, who are vulnerable, and specifically we are targeting women who are poor and vulnerable. So that is how we have identified the people or the women that we are working with. That is a process. It's a community process, and that process is being led by the community themselves. They search and they say, they draw their village and say, this household is a woman, she is having 5 kids, and she is poor. So we need to bring her on board. So it's a community process. That is how it is. That's how we are identifying the people or our target group that we are working with. In terms of when we identify the 500, when we identify them, we group them into smaller groups. For example, into 50, 50, 50, so that we can closely work with them in terms of engage them closely. Then what we do is that when we group them into 50s, we have been having some we've been having some conversations. Conversations, meeting with them, just to analyze their situation and understand better what are the real causes of this gender-based violence, and why are these women poor and vulnerable within the society. So we normally have a lot of conversations, a lot of discussions with them on a smaller groups. Then through that conversation, we normally come up with action plan on what are their priorities, what do they need for them to move from this point to the next point. They would draw an action plan for them. Now that action plan now informs what are some of the actions that we will, as ActionAid Ireland or ActionAid Kenya, the partnership that we have with ActionAid Ireland and ActionAid Kenya. Through that, now the actions that they come up with is, now we come up with some interventions, or with some we come up with methodologies on how to address their issues. Now, when we address when we are addressing their issues, we normally work with also the Women's Rights Network. We have also formed local women's rights networks. We closely work with these women from step 1 to the next step to the next step, to make sure that these women are free from violence and free from gender-based violence. In the societies that we are working in, if I give a small background of the societies we are working in, the society is a patriarchal society, or a male-dominated society. Actually, it is the man who takes over everything. It is the man who is right. It is the man who is always makes decisions. It is the man who will decide for everything within the society that we are working in. So it's a male-dominated society. Women are not heard in the societies where we are working in. So what we try to do is that through now that process, we identify what are the issues these women are facing, what are some of they come up with their own interventions, with their own, they identify the root causes of their problem and come up with suggestions on how they can move from this point to the next point for them to be safe, for them to be economically empowered. So the whole process it's actually a very engaging process, and it's a community-led process. It is the community themselves who are driving the process. As ActionAid, to their desired destination where they want to go. In terms of the COMBI, or the compatibility, capability, opportunity, and motivation, the approach, it's called COMBI approach. It is really a very engaging process. It's a process that is actually looking for the root causes of the real issues that women are facing in the societies that we are working with. It is able to identify the real cause of the problem. And the one advantage of also this approach is we are able to come up with clear interventions, or with clear action plans for this, for the hard to reach women or the vulnerable women. Very clear points, because it is actually it is actually a very engaging process. It's a process that is actually having a lot of conversations involving the women themselves. And now we don't also, what we do is, some of the issues that we are struggling here is cultural issues. It's cultural issues. So we also engage the cultural leaders within the society, because this society that we are working, I've said, it's a male-dominated society. Women are facing a lot of violations. In my place, or where violations. Among the violations women are facing, one is about FGM, that is female genital mutilation. Girls are being mutilated at the age of 6, 7, 8, 10 years. They are mutilated. And what does that mean? That means once they have undergone the cut, they are ready to be married off. So that comes in the child marriage. Girls are married off while at the age of 10, 15 years. You see a girl who is married 12 years, a girl is married off. And then what happens? This girl faces a lot of problems, because she is not yet matured. She is not yet ready to be a mother. She's not ready to take that responsibility. So these girls get a lot of frustrations, a lot of psychological problem, a lot of some of them they even become, they cast themselves and say, why have I been brought on this world? What happens to me? Why me? So what we do is that we normally have a lot of we normally work with these ladies. We counsel them, we give them psychosocial support, we give them counseling support. We also link these women. With the referral. Educational support to take them to school. Some will link them to economic support. Some will link them to the Women's Rights Network themselves to go and give them that morale, because these women, they feel they have been left out. Once this girl is married off, she is not ready for, so she gets a lot of psychological, a lot of stress, a lot of frustrations. They become very much stressed. So we normally give a lot of psychosocial support and link them to also to the government, because in this program we are also working with the government, because the government are the ones who are supposed to give these services to the people. So we normally link them to the government service, services. Like, for example, I have said these girls are facing a lot of violations. For example, FGM, that is female genital mutilation. I've talked of the child marriage. Women are not allowed in our society. Women are not allowed to participate in decision-making platforms. They have been let off completely. So women are not heard in the society. So we try to empower these women in terms of build their capacity, build their confidence level, build them in terms of their economy, so that, because when we develop these women in terms of economical empowerment, give her agenda and come to the decision-making tables or organs where decisions are made. So that is how we work with them, and the approach is really helping us. Identify the root causes of the problems the vulnerable women are facing within the society. The approach is also able to change people, because we have women today in the area that we are working. We have ladies who are economically empowered. They are coming to the decision-making platforms. They are giving their aspirations, and they are saying, we also have a right. We have got women who are saying we also have a right, and we have seen results through this approach. It really gave us clear results where you can touch and feel and say, this this lady A or lady B is able to move from point A to point B. So it could give us that clear result and clear picture of that change of the society. So and I've said before I conclude, we work with several actors, or we work with several is the government, and in the government we work with the police service, we work with the health department, we work with the education department. We also work with the cultural leaders, because these are the people that we need to change their thinking. These are the people that we need to change their perception. These are the people that we need to change their behavior. So we closely work with them so that they can change their thinking, they can change their perception, their attitude towards women. So cultural leaders and the religious leaders also. We also work with the religious leaders to make sure that they support and they give room and they give space to women to come and participate in decision-making tables. And the actors that we work are those actors, the religious leaders, the cultural leaders, the government in those line ministries. And we also work with other organizations that are doing some development work around the area. We partner with them. So I will say thanks to your support, it is really transforming and changing the life of communities, really impacting on the life of women who have been violated, women who have been left out, women who are like, they see themselves to be from sufferings to bringing them to a level where they can be able to stand on their own and give their views. So I'll say thank you. I'm sorry, I was just speaking from, I didn't prepare anything. I was just speaking from my mind, but that's what I will say for now. Thanks a lot. Back to Trina.
Thank you, Yusef. And thank you so much. I think you probably can see, I don't know anybody else who's been able to get so much enthusiasm. Like, I can feel it emanating from the screen. And Yusef is one of my favorite colleagues to work with, because he's so committed to the program and to women's rights. And, you know, he really has a huge amount of enthusiasm for the work, which is just so fantastic. And I think, you know, everything that he's been talking about in the past few minutes there, in terms of all the work with the hard to reach women, I mean, there's just so much we could speak about, but we know we have a very short period of time here today. We only have an hour, and I see lots of very interesting questions in there. But I guess the difference with this behavior change approach is that it's helping us to do much deeper analysis with the communities and really kind of focus on those three questions around capabilities, opportunities, and motivations for each of the behaviors. And that's what's helping us then to be able to target interventions that are hopefully more sustainable in the long run in terms of changing behavior. But I see we have lots of questions in, and they're very interesting. There is one for myself. I think it was about the review. Somebody was asking, a survey, was the survey carried out on Irish membership or wider? I'm not sure, is the question from Deirdre? Is that in referring to the evaluation of the last programme? But if it is, then the evaluation of the last programme, it was done with the countries that were involved at the time. So that was Malawi, Kenya, Nepal and Vietnam were in the last women's rights programme, and also ActionAid Ireland, where we do our public engagement work, which is about, I guess, telling the public, you know, it's in an event like this, you know, what work that we're carrying out, and, you know, the effect that that's having, and the importance of having support for overseas development aid. And we also have a national speech writing competition that we run every single year in secondary schools to get students to write about speeches on women's rights, and that's one of our public engagement events also. So we have lots of other questions here. I might direct a couple of them to Yusef. One is about, do we work with men in our program? How are we working with men in our program? And there's another question about, is there a minimum age for marriage in Kenya? And is FGM is FGM outlawed in Kenya? Is it illegal to carry out FGM? So maybe we'll start with those three, and then I see lots more coming in.
Thank
and
you.
Maybe, Yusef, I might ask you, if you don't mind, to turn off your video, just because you're breaking a little bit. So it might be, you might have a clearer connection if you don't have your videos. So sorry about that.
Thank you, Triona, and thanks, colleagues, for asking those questions. I'm happy because asking questions, it's a clear indication that people have understood you, and I'm happy about that. So the first question is, are you working with men? Yes, we are working with men because in the societies that we are working in here in Kenya, it's a male-dominated society. It's a male-dominated society, or it's a society that believe that everything can be done by men. Women can't do anything. That is a society that have that notion, that belief, and that perception that women have no space in this world. That's what they believe. So what we did is we deliberately targeted cultural leaders who are the custodians of culture in our society. So we are working with men and the cultural leaders are men, actually elderly men, opinion leaders men, men who make decisions within the society. So these are the people that we are working with. So yes, we work with men in the project. FGM, is it? Yes, it is a crime in Kenya. It's a crime in Kenya. FGM is not allowed in the country. Practice in the country. What happens is that the implementation and enforcement, and making people understand that is what we are missing in this country. People don't understand the laws actually, because we have in the society that we are working with, or in the communities that we are working with, there's high level of illiteracy. People have not gone to school. So reading that constitution and understanding itself, it's a problem. They don't understand because they have not gone to school. They don't know how to read and write. Education was not a priority to them because they see these are poor people. So they don't see education to be a priority. They prioritize food first of all. So due to that, so you see that the law is not practiced. The government of Kenya does not enforce also that law. So it's not allowed, but people still practice the FGM. In terms of the marriage age, yes, we have a very clear law within the country that says the age of giving a consent is 18 years. A girl can give consent, or she can be married off. She has reached the age of to make a decision on her own is the age of 18 years. But you see, the girls that we are working with are being violated at the age of 10 years, 12 years. They undergo FGM. They are cut. They are married off while they are still young. So the law is there, but the enforcement of that law is what we are missing. And people understanding the law itself is actually another challenge, because I've said people have not gone to school, and education is a challenge to them. Thank you.
Thank you, Yusef. There's a couple of questions from me here, so I might just answer those. So Deirdre has come back to say, thanks, Triona. And so those countries identified what was important in our support to them. So yes, you know, with the evaluation, everything is done in collaboration with the countries. And when we designed our next programme on women's rights, again, we had everyone actually come to Dublin for a workshop where we came up with the programme priorities for the next Irish Aid grant, and for the next 5 years really. So it's the countries themselves that come up with their priorities, and that's based on their conversations with the community members and the local women's groups. So that happens not just in the Irish Aid programme, but within all of our programming within ActionAid, where we use a human rights based approach. So everything is driven by the local communities, because they're the people that we serve. I have a question here as well from sorry, let me just move it back, because there's lots of other questions that come in since. I see somebody has put up a report on FGM in various different countries. That's great. Thank you for sharing that. There's a question, what is one key policy change that ActionAid advocates to protect and prevent FGM being carried out in Ireland? So the main thing that we're involved in terms of policy work around FGM in Ireland is we're part of the National Steering Committee on FGM, which is convened by an organisation called Akidwa, but has lots of organisations that are involved with working with the migrant community here in Ireland, including ActionAid. And one of the things that we're really pushing for now is for the government to adopt a national action plan on FGM. We've had one before that was drafted by the National Steering Committee, but wasn't endorsed by government, and that's now out of date. So we've been pushing for government to come up with a national action plan that includes, various members of different departments in government to come together. So Department of Justice, Department of Health, Department of Social Protection, and also to have members of the migrant community and representatives of the migrant community on kind of a steering committee or an intergovernment committee within the Oireachtas, within Leinster House, and for those parties to work together to come up with a national action plan that we can all contribute towards to end FGM. We do have a law against FGM in Ireland. And just to kind of answer another question that came up as well, or a comment about, it's better to prevent FGM than to provide counselling afterwards. The idea of our work here in Ireland, and we work with the migrant community here in direct provision to we've brought our training, our reflection action training from Africa to Ireland to work with the migrant community here to help them reject FGM. And one of the things that we're trying to do is to constantly prevent FGM, both in Kenya, and Yusef can speak to that as well, and across any country where it's being practiced. So that's always our first priority, is prevention. But obviously if things happen, there has to be a service there to help people try and get through that as well. But we do a lot of work around preventing FGM and helping the community to understand its negative impacts. Lots of questions have come in now. There's a question there for maybe you, Yusef, can answer this one, about how long do we spend consulting with the local women's groups and our local partners before we start to do our interventions, and what is that process like? And there's another question around what are the women identifying themselves as the main priorities that they want ActionAid to work on. So maybe you can answer those questions, Yusef.
Can Triona repeat for me the first question?
Yeah. So the first question is, how long do we spend talking to the women's groups about, what areas they want to prioritize, and how does that process work, that participatory process? And the second question is then, what priorities are the women's groups coming up with for ActionAid to support them with?
Thank you, Triona. We work with the women's local rights networks that we are working with. They are our partner actually. We have signed an MOU with them, and we work with them. Because these are organized local women who have come together, who have said now they want to move from these violations, they want to move away from this gender-based violence, and who are advocating for the rights of the women, who are trying to be champions. So we have an MOU with them, and we closely work with them and move with them throughout the journey. It's not a one-off thing; it's a process actually, because what we are trying to say, what we are trying to address here is changing the behaviors, changing the perceptions, changing the thinking of the community. So it's not something that, it's not a one-off thing, it's a process actually. So we closely work with them, we move with are actually, when they have their priorities actually, when a woman is in any meeting, in any community meeting, and when they talk of, when they raise their priorities, actually we have realized that they are addressing the real the real issue the community is facing. So women priorities are always right. Only that they are not given chance or opportunity to raise their priority. So what we are trying to work, what we are trying to do is we are trying to bring up these women in terms of building their confidence level, building their ability, building their capacity to come and challenge the men, the men, challenge the men in terms of decision making. And look, they say, look, we also have ideas, we also have priorities. Can you listen to us? So women priorities are usually the community priorities, and of late, people are trying to change their thinking towards women leadership, because we have realized the local structures, we have local committees, or like, for example, the water committee, the education committee, the health committee. Women, they are electing women in those local decision-making platform. And we have realized that when women are elected or appointed to those local community structures, their priorities is the community priority. Women talk of water. Women will talk of better health facilities. A woman will talk of better education for their girls and daughters and their sons. A woman will talk of livelihoods for their family. But you see, a man will talk of his own thing. He will talk of his own thing. And men here in our society, they're involved in so many other things. In terms of, for example, they're engaged in drugs. They're engaged in drugs. There's a drug called Mira, or it's a herb that they normally take. And when they take, so their priority is upside down. So women priorities are always, the women's rights priorities are always the community priorities. Yeah, I will stop at that. There was another question. Can I go to the other question, Triona, that was asking on how are we working with men?
Yeah, there's a question on how do we work with men in the community, and there's maybe a question that's slightly related to that as well, around, do you think, Yusef, that yourself as a man, that you have a better chance of introducing change than if a woman was doing the same job as you? That's an interesting one.
Yeah, thank you. Yes, Triona, and thanks, colleague who have asked that question. Yes, because I'm a role model. Myself, I'm a role model. I come from this society, and so I'm a role model myself. And I speak to the men, my colleagues who are men, and say, look, I'm a man, and I have a family. I have a wife, I have children. So I give them the opportunity. I give my wife the opportunity to come to the community meetings, give her idea, give her thoughts, give her what is her thought about the community discussions. So I challenge the male, the community, the society, that is the men themselves. I challenge them and say, I also give opportunity to my wife, and so there's no harm. Actually, we will even have better families when you give the opportunity to your wife to also better, you will form a better society and a better family. So I'm a living testimony myself, and I am very proud of that. And I appreciate ActionAid Ireland and ActionAid Kenya for giving me this opportunity to change my community who have very harmful cultural practices. Thank you.
Thanks, Yusef. Just my own opinion around that as well. The question is for Yusef and for ActionAid, is that Yusef is absolutely fantastic. And I suppose in a lot of our program areas, we have both men and women working. And it's not really about, I guess, who might have the most impact. I think it's more around, you know, sometimes when you work with men's groups, you need to have a man who will facilitate the conversations with men. And when you're working with the women's groups, it's sometimes easier if you have a woman who can facilitate the conversations with women, at least to start off with. But I think it's really amazing to have, you know, strong role models, people like Yusef, and we also have Caroline Nikarote and ActionAid Kenya, who are kind of leading from their own kind of perspective in their own lives as well. Yusef himself is from Kamute, so he's a great example in that community. So I think, yes, for certain conversations, it needs to sometimes be a male on male kind of interaction and a female interaction. But in general, I think, you know, really what we're trying to do is to empower the local women's groups to be able to lead community development on their own. We have another question from Aidan Clark here, and Yusef, maybe you can come in and help answer this too. It's during challenging times like the droughts and the pandemics, is there a slippage back towards early marriages and FGM because of the pandemic and droughts and other issues? And are the local authorities reinforcing your efforts with the program, or are they supporting the program or not?
Thank you, Triona, and thanks the colleague who asked that question. Yes, during emergencies, actually in Kenya or in this part of the country, in the northern part of the country, we face multiple disasters. And so people usually take a lot of time to look for water and pasture, and the community here are pastoralists. So looking for water and pasture is the main problem. So during drought, we have drought as one of the pandemics or one of the disasters. We also have disease outbreaks sometimes because of the scarcity of water. We normally face disease outbreak, and of course the COVID pandemic has also affected these communities. And so yes, when these emergencies or these pandemics happen, for example, the current pandemic that we are facing, the world is facing, the COVID-19 pandemic, we have realized, or we have seen, what we have seen is that the gender-based violence within the country has escalated. It has gone up. So during emergencies, GBV cases or gender-based violences normally goes up, and we have realized so many cases of defilement or rape. So these cases are on the increase actually during emergencies. But the lucky part for us is the location where this project is being implemented. We have realized there are some changes. There are some changes in the sense that those cases of violence against women and girls in the area that the project is working, it is not so much. It's not so much. It is happening, but not. We don't have so many cases. Unlike the other places which are next to the location where we are working. So what we are saying is the area where the project is being implemented, we have recorded very low cases of violence against women, but in the other places we have realized so many cases of violence against women and girls. In terms of working with the government, yes, I have alluded to my earlier presentation, is that we are closely working with the government, especially the local authorities, to make sure that they existing laws so that communities can understand and can follow the laws the way it is written and the way it is supposed to be followed. So we are closely working with the local authorities to enforce the law, and also to continue with the initiative, because we work with the chiefs. We have people who are called local administrators, the local administrators. We are closely working with them so that they can continue with the work that we are doing. Even if tomorrow, if we leave tomorrow, we are sure of the local administrators that we have been working closely with them will continue the work that we are doing, and they are really supporting us in enforcing and also in working closely with us to address the gender-based violences that are happening. Thank you.
Thanks, Yusef. We have about 10 minutes left now. I don't think there's any more questions in the chat box. Just to maybe expand a bit on Yusef's point there around the kind of a bit of slippage, like especially with this pandemic, and of course that's going to happen. But what we're trying to do is continue working with the Centre for Behaviour Change and trying to make sure that, you know, they have worked a lot with the UK authorities on trying to change people's behaviours in response to the pandemic. And we've had a training with the CBC online for all of our programme colleagues. So we're still taking their advice and, you know, using their approach to try and deal with the pandemic, first of all, in each of the countries, and to try and get preventative behaviours in place in each of those countries where we're working, but also to try and continue to look at the gender-based violence side of things, because that still needs a lot of attention. And in Kishushe, which is the other programme location in Kenya, the local government, the county government there actually, who are responsible for a lot of the, you know, the way Kenya is structured, they have, you know, quite a bit of influence at the county government level. And they have actually asked for, and they've had a behaviour change training within the county government themselves to help them change their behaviours to become to enable them to be more supportive, I guess, of the work of this women's rights programme, and the work that basically the women's organisations are asking them to do on their behalf. So that's all ongoing. And just maybe to finish up as well, and then I'll stop talking and just check and see if there's any more questions from anyone else. On working with men and boys in the programme, you know, we need to work with all of society because we're dealing with societal problems. And when I first visited Kamute at the start of this programme, and we met an amazing women's group, and we met then with a group of men by themselves, and I didn't understand anything because my colleagues probably quite rightly decided not to translate for me until the meeting was over. But there was a lot of shouting in Somali, and you could get a kind of a real kind of, you know, they didn't want us there, was the vibe from the men's group. You know, they were just annoyed that we were focusing on women's rights when there was like other problems in the community that they would have prioritized, things like access to food security, irrigation, all these kinds of issues. But Yusef has been working with those groups now for the past number of years. And through this behaviour change, like looking at their capabilities, opportunities and motivations, when they said to Yusef, you know, we've got other problems here, we need to deal with the problem of poverty and irrigation before we start looking at women's rights. Yusef helped them to kind of come to the realization for themselves that part of the reason why their community was so underdeveloped was because of, you know, actions that or behaviours that they themselves were taking, such as, you know, taking their girls out of school early, not letting them finish their education, having female genital mutilation, like all of the health problems for their daughters. And they really kind of started to realize, you know, that they were not helping themselves. So there's been a lot of support now. I think Yusef would agree with that men's group to try and promote, you know, education and, you know, further classrooms in that area and everything, in order to kind of promote women's rights, but also further community development. So I don't see any more questions here. I don't know if anybody else want to include a last question, or I see those reports I would encourage people to go and look at those reports there. I'm sure Joanne might share them with us in an email afterwards as well. Don't see any more questions there. I don't know this. Yusef, do you want to say anything else, or does anybody else want to?
Sorry, Triona. Can I add something on what you have just said? And I don't know if I spoke to that. How do we measure change? There was a question that was asking, how do we measure change or impact? Mm-hmm. If I look at in 2017, where the community were, and today, there is a great improvement. There is a great improvement in the sense that today in this community, you are able to see male who are champions of women's rights. We have male or cultural leaders who are champions of women's rights and are saying we need to give chance, or we need to give opportunity to our girls, to our daughters, to our wives, so for them to participate in decision making, for them to go to school, for them to stop FGM. So I could see there is a change in 2017, and today this society have greatly changed in terms of their thinking. Not all of them have changed, but quite a number of them have changed. And you could see a man, a wife, to come to the meetings and support her in the household chores, in cleaning utensils, preparing meal for the family, washing the young ones. So you see, you could see that change. So as a result of that, we are able to see champions, male champions, who are supporting the women's rights agenda and are giving chance and opportunity to the women. That's how we are impacting on change. In terms of livelihoods, in terms of improving the community livelihoods, because we have realized that women, because they are poor, so they don't have options. Their main source of livelihood in this community was cleaning clothes for others, and they are paid 200 shilling, Kenya shilling, small casual work. That's how they were living, how they were earning their livelihood. So what we said is, we grouped these women and supported them with irrigation farming. And today, women are having food on their table, and also, apart from food on the table, even some of those, the produce from the farms, some of them are being sold, and they're getting money. Their daughters' health. So we have seen quite progressive society, transformed society from where they were to 2020. There's quite a huge transformation within the society that we are working with. And I would say this is thanks to the great effort of all of you in transforming this. Thank you, Trina.
Thank you, Yusef. Yeah, I just want to say, I mean, that progress you're talking about in Kamuthe, it's just, given where we started at the beginning of the women's rights program, it's just absolutely phenomenal. And this is really your work, as in the work of all of you wonderful people who are supporting ActionAid Ireland and ActionAid in general. You know, this is your work that we're presenting back to you today. So I just think it's amazing. I think Yusef is fantastic. That whole program in Kamuthe and Kishushe in Kenya, and indeed in our other countries as well, you know, it's really starting to show impact and to show change. And we're so excited about the work. We have our, I think Joanne might have put up a link there to our field guide on behaviour change, which has taken us a year to write and to come up with that field guide, because it's very much in line with our own program, and we're using case studies from our own work. So I'd encourage people to go and have a look at that. We really want to kind of try and share that as much as we can, and we're going to be offering some webinars to people who are interested in piloting that approach if they're in the development sector as well. But just to say a huge thanks to Yusef for today. Thank you so much to all of you amazing people for all of the support and for funding this work with ActionAid Ireland. I'm really disappointed this year that I won't get to go and visit the programs, because this is my favorite time of year, when I get to go and do a monitoring visit and come back inspired by the community and all of the amazing progress that I see. But this year we'll have to have more of an online kind of, you know, monitoring visit, and hopefully we can get back out to the communities early next year. But, you know, from myself to yourselves and from everyone that I meet when I visit those communities, they always want me to come back and say a huge thank you to the Irish supporters, and to Irish Aid as well for making all this work possible, and to our amazing teams as well in ActionAid Kenya and all of our countries. Want to say huge thanks to Julianne, who's been organising all of the technical aspects to today, and Joanne and Siobhan and Eric and all of our team in ActionAid Ireland as well, and Killian, and yeah, just a huge thank you to all of our amazing supporters. Hopefully we'll get to see you all face to face very soon and have lots of cups of tea and be able to give you another progress report. But thank you so much for being here today. Thank you so much for engaging so well with all of your excellent questions. And, you know, we're here if you have any questions or any further follow-ups, you can email any of us in ActionAid Ireland anytime.